Good morning, good morning, good morning. Today is September the 13th, 2018, and I am coming to do a check-in with you guys to let you know how's everything has been going with me. I'll give you an update on I told you guys I got approved for the plastic surgery. I did the whole process, like I did the pre-op and things like that. But at the last appointment, I had a little setback because I had to. She told me to. She gave me the papers to get blood work and stuff like that. Then she requested that I did a mammogram because once before in May, I had an abnormal mammogram, and then their recommendation for me was just come back in 6 months and we'll do it again. So because I had that abnormal pap smear, she said, I'm saying pap smear. I'm sorry, I meant to say mammogram. Because I have that abnormal mammogram, she wanted me to go ahead and get another one because they can't do the breast reduction or the breast lift if the mammogram is not, is not right. So I went to get the mammogram on August the 27th, I believe, and she also ordered a sonogram too as well. So with the mammogram, they said that they seen something, but with the sonogram, they said they don't see anything. So I was very confused by that, and I asked the lady. I said, "Isn't the sonogram more powerful than the mammogram? Like, why are you seeing something on the mammogram and not on the sonogram?" And like, I didn't really like, I don't know, the way they were like talking to me, like. It was very, very confusing. Like they just weren't very nice about it all. But anyway, so the lady said, well, because you want to have the breast reduction and breast lift surgery, you have to. I'm going to request that you get a biopsy. And I'm like, what? Is it that serious? Like, and then, I'm really freaked out after that. For some reason, it just freaked me out. So, and like, it wasn't a lot of talking to me and like, and discussing anything with me. It was just like, this is what you need to do. And this is like, I was very upset when I left that place. But anywho, she set up for me to get the biopsy, but she also sent me to a different hospital, which she said they had a stronger equipment, better equipment, and they would be able to see everything better. So it's at actually West Penn Hospital in Pittsburgh. So when they called me, the breast imaging lady, they were very, very nice. She explained everything and she walked me through the process and things like that. And she said, like, we have to stick a needle and, get the biopsy. And she's like, you're not going to feel anything. It won't hurt. And then I'm like, lady, you can't tell me you're going to stick a needle in my breast and I'm not going to feel anything. She said, well, you're going to feel a little pinch, but, that's just going to be the numbing. Then after that, you won't feel anything. I'm like, well, I'm letting you know from the door. Like, I'm scared. I'm nervous. I don't like needles. It just freaks me out. So she was very understanding. So she even called me again before I went, and explained, talked to me a little bit more. So I went for the biopsy last Friday. And yes, they were very, very nice. And, and everything. So first they did another mammogram, breast x-ray, whatever, and it was supposed to be, it was in 3D. So, and then when the radiologist, I guess, came and talked to me, he said that his suggestion was, he said that he don't see anything, he just think it's breast tissue. He was like, just, come back in 6 months. And I was like, well, I'm trying to have breast reduction and the breast lift, and, can I have it with your recommendation right now? And he was like, oh, well, that's a different story, because they want a for sure answer if it is something or if it's not anything. So with that being said, they had to do the biopsy, because the plastic surgeon won't touch my breast unless they know there's nothing wrong. So with that being said, they had to do the biopsy. And so they set everything up, and I got it done, and it wasn't as bad as I thought it was. Like, they were very nice. I really didn't feel anything. They actually went, it was on the right boob, and they went in through the bottom, through the inside, and and I didn't look. I closed my eyes the whole time, and she was like, the lady was over here talking to me, and she was like, if you're nervous, don't look, and I just closed my eyes, and I just tuned out. But it went very, very quick, and they were right. I didn't really feel anything. I was so nervous. I don't know if it's because I was so nervous or what, but even when they first stuck the needle in to numb it, I really didn't feel it. I don't know what it was, but it was smooth sailing. So now I have to wait for the results. So that's another stressing out, So I got the results yesterday, Wednesday. I called them, because I was tired of waiting. So I called them Wednesday morning and left a message. And then she called me a few hours back, and she left a message, and she said, good news. And, I was happy when I heard that. So then I called her back, and she said, everything looks good. Everything was benign. Like, there's no problems. And he's just going to tell you come back in another 6 months. I said, what? 6 months? So can I go along with my procedure? And she was like, oh, let me talk to him. So she went and talked to him, and then he said, oh, yeah, sure. Go ahead and do what you were going to do. I'll push it back a year. Like, everything, because everything was benign, everything's good. You can just, get your normal breast exams. It's fine. So that was such a relief off of me, I tell you. So I was so happy to hear that. So I was texting everybody, like, telling everybody, it all worked out. It all worked out. I'm so happy. So, that was just another process that I had to go through. And I can say, I want to say, even though I was stressing about the whole thing, I didn't go back to bad habits of eating and snacking. Like, I didn't do that. I even started this week more fasting. I've been fasting for a while. I've been researching it, and I've been doing a lot of fasting. So I started the intermediate fasting, where I set a window for 8 hours of eating and then 16 hours of fasting. I've been doing that, and that's been helping me so much. During the times of fasting, it's like you're praying, you're stretching, you're drinking water, because the fasting is, as long as you're not taking anything in with calories, you're fasting. So when water has no calories. So if I feel like I needed water or something like that, then I drink it. But I've been doing so good with that. And then even when my eating window is, I haven't been making wrong choices. I've been making good choices, healthy choices, and, just taking good things into my body. So that's been working for me, this last couple weeks, and it's been getting the scale moving. I can say it's been getting the scale moving. So I'm very happy with that. So right now I'm going to do a quick weigh-in. I'm going to let you know what my weight is, and then the next part of the plastic is me just waiting for the breast imaging to send the results to the plastic surgeon, and then they will call me with my date and stuff like that. I already have prescription to get the meds that they want. I already have the surgical soap and everything they wanted me to wash with, because I did my pre-op already. It was just this little bump in the road of getting the mammogram that I had to deal with. So that's all set. I got all the insurance approval and everything. All of that went through, So in my head, I'm thinking that it was all meant to be. Everything is working out, and I'm glad everything is working out, because that's just one more bump in the road I just did not want to have to deal with, But with, prayer and fasting and, my God, everything worked out. So I will update you when they call me and when they set dates up and things like that, and let you know what my next part of the journey is. And that's all I got to say. So let me step on the scale. I can let you guys know where I'm at. And I can't do it. I'm sorry for the lights. You'll be able to hear it.
Body weight is 175.8 pounds.
Yay!
Body weight is 175.8 pounds.
Good job. 175. If you guys know from previous videos, 175 was my goal that I wanted to be at, and I made it. I've been going up and down in the 180s for so long. See, I told you this fasting thing is working. Eating right, fasting, and just controlling what I put into my body has been working for me. So I'm loving it. So I'm going to keep you guys posted when I get more information. And I thank you for watching the video. And I reached my goal weight, my own goal weight. My doctor's goal weight is 160, but my own personal goal weight for myself was 175. So just pray that I can maintain and stay under it and do what I need to do. I'm going to see if I can try to reach no, I don't want to reach 160. And if I do, I don't want to go below it. I just feel like I know what's a healthy way for me, even though BMI say whatever. I know how I feel when I'm at a certain place, and for me, my 175 is my happy place. So if I get a little below, hopefully I can maintain and not go back over 175. And if I do, I know I'm doing something wrong and I need to switch something up. So I just want to say thank you guys for watching, and I'll check back in soon. God bless.